friends. Hope you are having a good day. Life is, beautiful, complex, a mixed bag of highs and lows. Life is complete only because you take care of your family, your work, and your home. But how often have you stopped to take care of yourself? When did you last prioritize your health? Have you ever given this a thought? Now don't think, just watch.
Every organ in our body is made up of cells. These cells divide and multiply as the body needs them. Sometimes these cells continue multiplying even if the body doesn't need them. The result is a mass or an abnormal growth called a tumor. Cancer is a disease characterized by the uncontrolled growth of these abnormal cells that have a tendency to spread to other parts of the body.
Today I am going to discuss breast cancer, a disease that affects women in particular. Did you know that worldwide almost 23% of cancer cases that are detected are of the breast, and 1 in 34 women is diagnosed with breast cancer in urban India? But don't let these figures scare you. Breast cancer can be treated depending on the type of cancer and the stage. So let's try and understand what causes breast cancer. There are several risk factors for breast cancer. Some factors that we can do nothing about include aging, genetic or inherited risk from the maternal side. However, this factor is seen in only 5% of the cases. More importantly, some lifestyle choices we make could lower the chances of getting breast cancer. These include having babies, because not having children or having them late can increase your chances of getting breast cancer. Breastfeeding. This is one more reason why the breast is best for both mama and baby. Reduce alcohol consumption. Get moving and control obesity. Consume a low-fat diet and quit smoking. It was never good for you anyway. Remember, I told you about how you should take care of yourself? You can prevent the growth of cancer if you keep a check and look for these symptoms in your body. Listen to our doctor carefully.
The symptoms of breast cancer can be varied. The commonest is the appearance of a swelling, a thickening, or a lump anywhere within the breast. It could also be a change in the appearance of the skin of the breast, like dimpling or puckering of the skin of the breast. It could also present as a change in the appearance of the nipple, that is, the nipple could be pushed or pulled to either side, or it could be inverted. Sometimes it may present as a discharge from the nipple, which may or may not be blood stained. Rarely there may be reddening or thickening of the skin of the breast. Sometimes the patient may present with persistent pain in the part of the breast, and very rarely there may be a swelling which appears in the underarm, which is also a presentation of breast cancer.
So how do you check for these symptoms? Just don't worry. Remember, an early diagnosis can cure cancer. You can do a basic self-examination which can help detect any symptoms of cancer. Here's how. Stand in front of a mirror. Put your hand behind your head and look for a change or lump around your breast. Look for a change in the shape and size of the breasts and for any lumps by putting your hands on your hips. Raise your arm and examine your breast using your index, middle and ring fingers in a flat circular motion. Squeeze your nipple to check for any unusual discharge. Repeat the whole exercise while lying down on a bed. Remember, every lump is not cancerous, but make sure that you get it tested. Do this exercise once a month around the same time and avoid it during your periods.
Special test which is done to detect tumors within the breast. Even when the tumor is less than 1 centimeter, when it cannot be palpated by the hand during a self-breast examination or a clinical examination, it can be detected by the mammogram, and depending on the appearance on the mammogram, the doctors can get an idea whether a particular tumor can be malignant or non-malignant. It is advisable to undergo mammography every year after the age of 40 years. And those persons who are at high risk of developing breast cancer, that is those who have a very strong family history of breast cancer, are usually advised to start mammography at a much earlier age.
Did you hear that? Now, don't be lazy, shy, or laid back anymore. Gift your mother, sister, or friend a mammography test. Take your friends along and educate them. Thank you for your time, and remember to take care of yourself and your body. And yes, life is beautiful. If you need any more information on breast cancer, please visit www.indiancancersociety.org.